An active life is a healthy life, but the risk of an accident is ever present. At work or during sporting activities, accidents can happen. Sometimes the result is a painful bone fracture. A fracture means the loss of use of the bone. Sometimes an operation is necessary. Although the injury is usually temporary, a fracture can cause serious trauma with irreversible effects. The skeleton, the beams and rafters of the body. What are its functions? It acts as support for the soft tissues and mooring for most of the muscles. It influences the type and amplitude of our movements. For certain vital organs, it's protective armor. The bones of the skeleton are also a reservoir of minerals from which the body draws as needed. There are 3 types of fractures. If this downhill skier were to fall on the slopes, he'd be likely to suffer the first type of fracture, a broken bone caused by a direct or indirect shock resulting from a fall or blow. When this type of injury occurs, the victim is rushed to hospital. The second type of fracture, the spontaneous fracture, is caused not by external violence, but by the pathological state of the bone. A bone weakened by osteoporosis is susceptible to this type of fracture, which frequently affects elderly people. Finally, there is the stress fracture, or fatigue fracture, a minor break resulting from numerous microtraumas. This jogger would be prone to a stress fracture if he intensified his training rhythm too quickly. The recovery process begins immediately after a fracture occurs. It has 3 stages. First, a blood clot is formed around the ends of the break. When a fracture occurs, the internal vessels of the bone bleed. This bleeding creates a swelling, called hematoma, followed by the formation of a blood clot. Several days later, fibroblasts enter the blood clot. The blood clot then becomes a fibrocartilaginous callus. In the 3rd stage, the fibrous tissue develops into a bony callus. The callus, nourished by mineral salts from the periosteum, knits together the extremities of the fracture. At first, the callus is spongy. Gradually, it's transformed into a compact bone as the injured person resumes normal activities, exerting pressure on the bone. How is a fracture treated? Sometimes the doctor does not immobilize the fracture, but concentrates on controlling the pain. Fractures occurring in the toe area, the collarbone, or in this case, the ribs, are usually treated in this manner. The purpose of treatment is to allow the patient to resume normal activities as soon as possible. The broken bone is put back to work, which contributes to its recovery. To treat a fracture, the doctor must first establish a diagnosis, deciding whether reduction of the fracture is necessary and which type of fixation will provide the patient with a rapid recovery and no after effects. Reduction of a fracture involves realigning a bone which has been dislocated. The injury will only heal if the 2 sides of the fracture are in contact with each other. Most fractures can be reduced without surgery. Using a local anesthetic, the doctor manipulates the fracture to reposition the bone. An X-ray confirms that the bone is positioned correctly. After the fracture is reduced, it must be immobilized. If it moves, the bone edges could knit together improperly, creating a rotation or deformation. External or internal fixations are the answer. Plaster casts have been used for the past 100 years to create external fixations. The cast is a good method for simple fractures, like this broken arm. This injury will heal in 3 to 4 weeks. But this broken shin bone will take 3 to 4 months to heal completely. In some cases, the plaster cast is not the best solution. Open wounds near the fracture must not be covered. They must remain visible so the doctor can monitor their progress. A cast would also increase the risk of infection. An infection that is improperly drained can attack the bone and cause osteomyelitis, which can have serious consequences. Some fractures require internal fixations, such as nails, screws, plates, or pins. The surgeon repositions the bone and attaches an internal fixation, which acts as a brace. Internal fixations can only be positioned through surgery, but this means the fracture will heal more slowly than one treated without surgery. After the fracture has mended, if the patient feels no discomfort, the metallic objects are simply left in place. If there is discomfort, they're removed. The skull provides protective armor for the brain. A fracture of the skull is serious to the extent that the brain is affected. Because the condition of the brain is of more concern than the fracture itself, neurological treatment takes priority over treatment of the fracture. This patient has suffered a cranial trauma. The doctor must determine the neurological state of his brain by assessing his ability to speak and move. A scanner can locate other lesions, even if the symptoms are not readily apparent. However, the success of the scan depends upon the area affected, because certain vascular lesions are invisible at first. In such a case, the scan could read normal, although the patient is in a coma. There are two types of skull fractures: linear fractures, which form a line on the surface of the skull, and depressed fractures, in which the bone rests on part of the brain. The linear skull fracture is not, of itself, a serious injury, but it is essential to ensure there is no underlying cerebral lesion. If the brain has suffered an associated trauma, the effects may only become evident after a while. Even if the patient seems to be in good health, he or she is kept under observation for 24 to 48 hours to ensure that a blood clot has not formed. The fracture is left to heal on its own. A depressed fracture may be serious, depending on the degree of indentation. If the bone presses on part of the brain, it may affect functions like motor skills, language, and behavior. Now let's consider fractures to the spine. This type of injury can have permanent after effects. Treatment is aimed primarily at protecting the spinal cord. The spine is composed of alternating layers of bony segments called vertebrae and spongy bodies called discs. The spinal cord, part of the central nervous system, is located in a canal running the length of the spine. At each vertebra, nerves leave the spinal cord and move out towards the limbs, forming the peripheral nervous system. It's less vulnerable to partial lesions than the spinal cord, which provides us with vital support through all stages of life. An injury that often occurs among elderly people is the hip fracture. Present among men and women 60 years and older, it is most frequent over 70 years of age and accounts for half of all fractures among people over 65. Contrary to popular belief, the slippery sidewalk is not the main cause of hip fractures. Most occur at home, early in the morning, when the elderly person gets up and heads for the bathroom. Vision disorders, sleepiness, or reduced visibility due to darkness are among the explanations for these falls. This elderly woman has broken her hip in a fall. Physiotherapy is used to help her to recover. The fractured hip was operated on within 24 hours of the accident and set as rigidly as possible to allow her to quickly regain use of her hip. The sooner she's able to use the fractured bone, the faster the healing process. The physiotherapist evaluates her condition. Can she turn over in bed? Get up without assistance? Can she walk with the help of a walker? What kind of pain does she feel? What movements are possible? She will then receive treatment that is adapted to her needs, taking into account the surgery that was performed. Usually, 5 physiotherapy sessions per week are given, each 45 to 75 minutes long. Stress fractures, unlike those caused by a significant external shock, are the result of numerous repeated micro-traumas. A long-distance runner who trains too intensely or in a non-progressive manner may develop a stress fracture. Other sporting activities, such as tennis, walking, and skiing, are potential causes, as are competition sports. Of course, most fractures occur during accidents, so they can't be avoided. But some protection from injury comes from regular physical exercise, which strengthens bones and increases muscle tone. Strong, healthy bones also come from a balanced diet and good nutrition.